He is talking about the deep learning-based outcome segmentation of the parotid gland tumors using MRI.
Thank you for introduction. My name is Esat. I'm from Turkey. Today I'll make a presentation titled Deep Learning-Based Automatic Segmentation of Parotid Gland Tumors using MRI. Parotid gland tumors are the most common salivary gland tumors. Although there are many types of parotid gland tumor, the most common benign tumor are pleomorphic adenoma and Warthin tumors, and most common malignant tumors are mucoepidermoid carcinoma and adenoid cystic carcinoma. The most sensitive imaging method in the diagnosis of parotid gland tumors is MRI. And we aimed for automatic segmentation of parotid gland tumors using MRI with deep learning methods. Firstly, naked MRIs of parotid gland tumor cases operated in our hospital in the last 4 years were included in our study. All images were obtained with the same MRI scanner. And we had only 2 exclusion criteria: pediatric patients and patients with significant motion artifacts. A total of 80 patients were obtained in our study. T1 sequences and T2 sequences and contrast enhancement T1 sequence were included in our study for segmentation. And parotid tumor borders were drawn by the joint decision of 2 radiologists for manual segmentation. These are examples of our patient T1 sequences. You can see right parotid gland tumors and manual segmented parotid gland tumors, contrast enhancement T1 sequences and manual segmentation, and T2 images, manual segmented right parotid gland tumors. All images were then cropped to standard size, and then all of the patient masking was performed. 70 images were split for training and 10 images for testing for each sequence. And then ResNet 18-based Deep Lab B3 plus deep learning architecture were used. This is workflow of our study. You can see raw images, T1, contrast enhancement T1 and T2 sequences. And we cropped all of the patient, and then we masked all of them. And then standardization was done in here, model development process, and we divided into train set and test set, and finally performance metrics. As a main result, as you see from the table, most successful sequences was T1 contrast enhancement T1 sequences. This is almost 92% accuracy value, and then second most successful sequences, T1 sequences. This is 83% accuracy value, and T2 sequences less accuracy value, 77%. These are examples of automatic segmentation from the deep learning architecture. You can see here left parotid gland tumors, T1 sequences tumors, and automatic segmentation from the deep learning architecture. Contrast enhancement tumor and automatic segmentation, it seems very high successfully. And T2 images, left parotid gland tumors, and less accuracy value, less successfully T2 images. In light of this information, although contrast enhancement T1 was the most successful, non-contrast T1 and contrast enhancement T1 were still in the computation. Automatic segmentation studies have been increasing in recent years in the literature. As we told malignancies, segmentation of parotid gland tumors is important. Why it is important? Because of more accurate differential diagnosis and correct surgery preparation and correct radiotherapy planning. As I conclude, parotid gland tumors can be segmented very successfully with deep learning architecture. There are some limitations in our study, small number of patients, single center study. These are my references, and thank you for your attention.
Thank you, Dr. Esat. Any question?
Thank you.